Thank you, Professor Sufikar, Professor Leo, and all distinguished professors and all participants. It is indeed honor privilege to be back to NTU and share some of our experience from the neighboring city of Jakarta. Visit Jakarta is not that far from Singapore, and what I will be sharing today about urban leadership has a lot to do with the crisis that we went through since 2020, which is the COVID pandemic. And it hits countries across the globe, cities, and I think now is time for many of us to start picking up lesson learned. In Bahasa Indonesia, there is a word called Hikmah. Hikmah is lessons that you pick up after a period or after something is happening. Then it is called Hikmah. And the Hikmah is always coming after the crisis, after the event. No Hikmah is coming before the event, before the crisis. So now it's time for us to start learning, picking up some of those lessons and prepared us better for future challenges. We hope we don't have to face similar challenge, but if we do, what are key lessons learned that we can pick up from the crisis that we had? So allow me to share some of the basics about Jakarta. Okay, yeah. Just a minute. Let me make sure. All right. Give you basic data. Jakarta is a city of 11 million people within the city, plus its surrounding, its neighboring cities, another 23 millions. So plus minus, it's about 35 million people in that area. And the city contributed about 17% of Indonesian economy. So on the one hand, we are congested in terms of populations. The number is 11 millions compared to the entire Indonesia, which is 270 millions. So the proportion is small, but on the other hand, our contribution to the economy is huge. And Jakarta is the gateway of Indonesia. If you enter Indonesia, then the gateway is Jakarta, and if you're departing to the world, it's always through Jakarta. So when we started to see a contagious virus in Wuhan, at that time it was December 2019. We were monitoring in Jakarta, and at that time it was still called pneumonia Wuhan. It wasn't called COVID, and I think SARS-CoV-2 virus was there, but rarely mentioned. It was basically pneumonia Wuhan, and we are monitoring closely. Why the Jakarta government monitoring closely? Because our city is having direct connection with Wuhan. There's many direct flights coming in, and then our city is the hub of Indonesia. If we are having problems, then the rest of Indonesia will at some point also experiencing what we are experiencing. So it was our concern. And I remember in the beginning of January 2020, we had meetings with interdepartments representative. And those meetings, the immigrations was invited, the intelligence office was invited, all agencies that relates to mobility, that relates to international travels were all invited. it is a rare occasion because Jakarta government rarely inviting all those agencies that deal with international travelers. Usually it is, we're dealing with domestic travelers, but this time was international travelers. The question was this: how many people coming back from international places where the virus have been detected then? And our data was so minimum. We had minimum database on tracking people. And I think at that time, we're not tracking people yet. We're not identifying where have you been visiting of cities, of countries at that time. So very minimum information. So immediately, we start our second approach. Let's identify to anyone who have symptoms similar to pneumonia Wuhan. So we send like a booklet, like a instruction book to all hospitals in Jakarta. If you are seeing patients with these symptoms, do report to us. What basically we're doing is this: let's anticipate what is coming from outside, and then two, let's anticipate what is happening within our jurisdiction. We have about 190 hospitals across Jakarta. So all hospitals were having these instructions and they have to monitor. So we have been receiving reports of individuals with similar symptoms of COVID. At that time, we're talking about early 2020, the authority to undertake the testing was not in the provincial government. It is at the national government, Ministry of Health. We have PCR machine to do testing for viruses, but we didn't have the reagent for extracting and doing the testing. Only labs that is authorized for certain virus, they will get the reagent for that particular virus. So SARS-CoV-2 was not on our list. So we didn't have the reagent, even though we have the PCR machine. So what happened was we keep sending samples collected from hospitals to our Department of Health, sending it to central government, to the Ministry of Health, the laboratory. However, we keep getting answer that the answer is no answer, basically, at that time. We didn't get, is it a positive? Is it a negative? Basically, we didn't get an answer. We keep sending samples and we don't get answers back. Now, our team is reporting to the governor. The governor, we have been reporting this many. We have not heard anything back. What should we do? So we communicated with the Ministry of Health, demanding result, being informed to us. We didn't get any reply. This is talking about how should we deal when we are facing this kind of situations. What should we do? Should we just wait or should we do something? I decided to go to the public and report to the public that Jakarta, it was 1st of March 2020. I went out to the public and said, we have had X patients under surveillance, under monitoring. And these are numbers of individuals detected with symptom of COVID. And it was a news that the country has been avoiding for weeks. Nobody wants to talk there is COVID in Indonesia at that time. And it was, I announced it in the morning, late afternoon, the Minister of Health were saying the number reported by Governor of Jakarta was incorrect. Okay? So basically, they were saying there is no cases. And we come up with that. But what are the key aspect here? Why there is that difference? The Ministry of Health, who has not been out front in explaining what is happening, and our approach that has been, let's open up, let's uh, inform public. Here's the difference, or here is our lesson learned. During the period of January, February, we have been reading what is happening outside the country. Our team were monitoring news outside Indonesia, reading policymakers outside Indonesia, talking about COVID. If your team don't speak English, then you know nothing about what is happening outside the country. If you don't read things outside, you have to really understand what is happening in the world. So in March, not long after that event, I gathered about 150 leaders of our city. These are head of departments, head of agency, head of bureau, head of hospital, directors, all, about 150 people. Gathering, just like this gathering, 150 people. And I started the gathering by asking simple questions. Raise your hand if you read news about Jakarta every day. So all these 150 people were raising their hand, all of them. Because they work for Jakarta. They better read news about Jakarta every day. Everyone is raising their hand. Second questions. How many of you read news about Indonesia every day, national news? Almost all, not all, almost all. Third questions. How many of you were reading world news, global news every day? Only 7. Okay? So I mentioned to all of you. So for all of you, from now on, listen to what I'm going to say and trust me. Okay? Because you have not been following news outside Indonesia. If you don't follow news outside Indonesia, then you don't know that there is, a disaster is coming. And we better be prepared. Rule number 1, I mentioned that in that room. Do not handshake from now on. And everyone's like, do not handshake? What do you mean? No handshakes? Yes, from today, no more handshake. Social distancing. And everyone's saying, really, social distancing? We used to be very intimate, right? We meet each other, we kiss, we hug, we handshake, and then suddenly stop all of that. So all these measures that not us invented those measures. We are learning from others that have faced these problems earlier than us. It was March. Wuhan experienced it since November, December, and then Korea experienced it in January, and then Iran is around that time, Italy is around that time. We are picking up lesson learned from them. And we share that to our team. And then number 2, what was also a lesson learned is this. We realized early on that this kind of, quote, disaster is going to take place in a long period of time, which we don't know how long. It could be a year, it could be 2 years, it could be 3 years. We didn't know at that time. But it's not going to be over in the next few months. And then we look at data of the last pandemic, the flu pandemic in the early 20th century. And you look at the data, it takes so many years for that pandemic to end. So we're expecting, and we start looking at numbers of casualties in Jakarta, in Indonesia, during the flu pandemic. And the numbers of death was quite significant then, in the 100 years ago.